Hello, my fellow humans. Welcome to the CyberPulse Podcast. Today, I'm joined by Jim Carlough, a transformational leader known for blending humor, charisma, and real-world leadership insights. Jim's workshops and keynotes are packed with practical tools that you can use right away, and his energy is truly contagious. Jim, welcome to the show.
Well, thank you for having me here, Justin. I'm really excited to be here, and hopefully we can inspire some people in your audience.
Yes, hopefully we can change some lives out there. For our listeners who may not know yet, can you share a little bit about yourself and your journey?
So, I've been in healthcare my entire professional career right out of college. And as I've grown and developed as a leader, I've noticed certain tendencies of younger leaders and managers in terms of what traits they have and what traits they don't have. And in fact, I'm a firm believer that people aren't born leaders. Leaders and leadership has to be developed. And it can't be developed without the interpersonal relationships that you encounter in management and leadership to help frame the framework that you ultimately manage under. And over 30 years, I've seen my own leadership characteristics dramatically change. In fact, a few weeks ago, I was reflecting back on my first management job and realized how horrible of a manager I was, and that I probably owe all those people a note of apology, right? Because I manage very differently today. Well, and think about it. I graduated college in 1983. Leadership in 1983 was very authoritarian, and people would just say, okay, Justin, go do these three things, and not give you any direction, not give you any assistance, not give you any collaboration. And you were expected to go do that
Good
or
luck.
find a way to do it. And good luck, hope and a prayer. Um, and and today, that's totally not the way people should lead. And to me, leadership is collaborative. And there's also a difference between a manager and a leader, where a leader is more visionary and creating the pathway for people to believe in what you're trying to achieve. And a manager is more of a taskmaster in today's society, one that's focused on the individual tasks that need to get accomplished. And so, in terms of leadership itself, that leader has to be able to connect with individuals in order to get them to buy into the strategy, to buy into what you're trying to accomplish as an organization or even as an individual team within an organization. And as I've mentored people in the last 25 years, I've noticed that they understand their industry, but they don't understand people.
Ooh, so key there. Yes.
Yeah. And so, what I focus on when somebody comes to me and asks me to help them and mentor them, I focus on the characteristics that they don't have and that they probably were never taught. And we in business have done a terrible thing to some people. We take the best person in the task level and we make them managers, whether they want to be a manager or not. And we hope that they can make it as a manager. And then we really don't have a program or a roadmap for them to follow to kind of master those tasks.
I feel like managers can be leaders, but allow them to understand how to kind of think outside of that managerial task that they have to do and lead. Like I've always said, you manage things and lead people.
Absolutely
How
correct.
do people, if you're like, say like you're a manager, how would you think outside that box? How would you become a leader? I know some managers are leaders, but many of them don't really have that right skill or understand that they are leading people and their managerial skills.
Correct. And so that's why I've created this sort of independent roadmap of things that really people need to learn and develop to really evolve into that leadership role, to be able to influence people and to have people loyal to what the mission is and what you're going to accomplish. And these characteristics aren't rocket science. But what I've done is I've released a book that gives you these 6 pillars. It defines those pillars and then also gives you references to other people around the world that use that characteristic in their leadership style, and then also give you ideas on how you can even implement that on your own. So it really is a roadmap. Now, somebody could say, and rightfully so, there's more than 6 characteristics of a leader. However, when I started making my list, I wanted to give everyone something that was implementable in relatively short period of time by taking one item at a time. And I focused on the 6 items that I thought was most important at this time in history in what we're dealing with around the world.
I like that because, like they said, there's more than one way to skin a cat, but you gotta learn and start somewhere. Like how you put down the 6 pillars. 'Cause you said, "Oh, well, there's so many more ways." Well, just start here, focus on this, and you can kind of grow into those other ways if you deem necessary.
Absolutely correct. I mean, there's clearly, if you become a leader, you need to know how to read financial statements. You need to know how to set budgets. You need to know, all of those other things that you have to do. But my assumption is that an organization is going to give that help to someone. However, it's the interpersonal things and things that make a difference in employees' lives that I focused on because I've learned that those are keys to creating a loyal following and to be able to create highly productive teams.
Like that because people, they could do all the administrative work, they do all the back end stuff, but they don't know how to effectively work with the people in their company or understand they need to have conversations and talk with those people in the company and lead them effectively. What are those 6 pillars that you've created? I'd love to go over those.
So the 6 pillars, the first pillar is integrity. And
Yes.
to me, that pillar is non-negotiable. And I tell people who work on my teams that it's non-negotiable. And my expectation is that they will act with absolute integrity as well. Because if you don't have integrity, you can't build trust. If you can't build trust, you can't build loyalty. And if you don't have trust and loyalty within the employee ranks, they're not going to follow you into battle, number one. They're not going to be totally committed to the mission or the vision of where you want to go. And unfortunately, whether you're a new leader or an accomplished leader, you're always being put to that test of, how are you reacting to every situation? And it's probably more important for a new leader as they step into a role because they may be coming from the same team they worked on and now they're going to transition into a manager role. And I don't think they really understand sometimes the microscope or the magnifying glass that they're going
I
to be
think a
put.
lot of them do. I didn't understand it at first.
Yeah. So we spend a lot of time on integrity, and then we also have compassion and empathy. And those
Ooh.
are 2 very different pillars, but they're very important. With compassion, you can relate to the employee's situation and offer them guidance or time or assistance. But with empathy, you can actually put yourself in their shoes and solve the problem for them. And a lot of leaders confuse compassion and empathy, but they are very, very different.
Ooh, I like that. Compassion, empathy.
And then the next 2 are focus and stability. You have to, as a leader, have focus on what your vision is, or you'll never accomplish it. And you can't be scatterbrained with your vision, or people won't understand it and will think that we're always changing the strategy.
That makes sense. Like, "Oh, well, let's do it this way. Oh, let's do it this way. Actually, no, I changed my mind." Like, "Whoa, buddy, what are you doing?" I
Correct.
get that.
Let me give you a perfect
Yeah.
example. And I have several examples in my book, but I'll give you one from my book. If you think about focus, think of Jeff Bezos from Amazon. He started in the mid 90s selling books over the internet. And he said, okay, if I can sell books, I can sell retail objects, I can sell clothing, I can sell food. And he's amassed, and he has been so disruptive. You can go to a lot of malls in America today where there's a lot of vacant stores, and a lot of it is because people are shopping via Amazon, and the brick and mortar just adds too much expense to the bottom line. And
100.
so that disruption, but his singular focus on that and achieving that success and actually, I should say unwavering focus has led him to create what he has created.
It's like it seems like the more you create, the more people hate you. But it's kind of for the wrong reason because they don't understand when you're trying to build a business, like there's gonna come these things in time with it that they just don't understand what's going on and what you're trying to accomplish.
Yeah, and I'm not sure it's truly hatred. It may be more jealousy than hatred
Okay, man, that sounds like a better word.
because,
I call them like online haters, you know?
I was gonna say there's too much hate in the world today.
Yeah.
Jealousy, I think, is probably a more appropriate word, and I could say I'm jealous. I didn't come up with the idea. Now, had I come up with the idea, other people would be jealous of me. But anyway, and then the sixth and final pillar
Yes.
is a little bit different than the other ones. It's humor. And the reason I picked humor as to be one of the more important, in the top six of things is people are too stressed out at work.
Ain't that the truth?
We have gone a little bit overboard with putting pressure on our people to complete tasks shorter and shorter and shorter time, and I think we have to take a step back and make sure people are enjoying their job. So when I say humor, I don't mean being a stand-up comedian and then holding court at the water cooler telling jokes for 20 minutes. But I use humor to kick off a meeting. I use humor to refocus people in a meeting, to kind of get people back to the task at hand. Because sometimes you're sitting at a table of 10 people trying to come up with ideas, and you start debating and arguing, and you're forgetting what you were really sat down to do in the first place.
Gotta break that flow of theirs to
Correct.
refocus.
Or
Yeah.
also use it in times of stress where two employees may be having a disagreement and trying to level set and trying to get them to take a breath, relax, and then offer to sit down with them to help collaborate to resolve what conflict they may be having. So it becomes a very, very effective management tool.
I've actually encountered that quite recently. I see like so many people are stressed out of their jobs. They start kind of taking it out on the employees. This was like little things like snapping here and there. But you can't take it personally, but you just see they're so stressed out, but they don't know how to handle themselves accordingly. And they're overworking themselves, but it is all this, it just comes out as this like snapping and this like yelling and whatnot. And it's
Yeah.
really unfortunate. Like, you know they're a good person, but it's like you need to step back and like take care of yourself. If you don't take care of yourself, you can't take care of me or the other employees here. You can't.
One of the things that I say often to my team that's always trying to rush through something, and I don't mean any disrespect to any surgeons that may be listening to your podcast, but even though I'm in healthcare, what we do in technology is not life or death situations. So, what I tell people is look, we're not performing open heart surgery. We're not going to do harm to any individual if we take an extra day or 20 minutes or whatever it is to invest a little bit more time to figure out either the right solution or the best approach to something.
I like that, the best approach to something. I feel like we don't do that enough. We just get this is like, okay, we're doing it this way. And then it goes downhill from there.
It goes downhill from there because people are given so many objectives that they have to hit. They're trying to check off that sheet as fast as they can because they know there's more work coming. But at the end of the day, you want your work to be recognized, complete, and effective. You don't want to have to repeat it or redo it, which causes additional expense. So why not invest the time up front and do it right?
And I have to remind myself of that every time because like I work in cybersecurity and IT, and we have to make sure like things are up and running so they can do their jobs. And we have to kind of make sure we slow down, make sure we get it right the first time. But sometimes people don't understand with technology that sometimes I don't know what's going on. I don't have the answer. It takes time to try and find it and go. And I have to just kind of go through steps to figure it out. And sometimes I don't always figure it out.
And especially in cybersecurity. I mean, that if we look at what's happening today around the world and even in healthcare, we're
Mm,
getting hacked by hackers every day.
it's
And
crazy.
it is crazy. And these bad people are taking that data and selling that data. And, it puts organizations in jeopardy. And, from a cybersecurity perspective, that's a huge, huge risk. And so I was talking to our security officer one day, and I said to him just off the cuff, Kurt, how many pings a day do we get where people are trying to hack in? It was in the millions. It was like nonstop. And he showed me a graph, and I was actually taken aback by how bad the situation is. Now, luckily, there's never been an exposure, But how to protect against that volume, the odds are against every organization. But, again,
Yeah.
you got to equip yourself as best as you can.
I like how you put that, how you protect against that volume. Because like two things, most organizations don't understand their risk profile or even what that is. And second, they don't even understand the constant attacks that are coming in and how us as IT to put that into words that they understand. It sometimes doesn't go well. There's so much going on in the background. People are trying to get into their computer. They think like, "Oh, we're a small organization. It doesn't matter. We're okay." But as a leadership of that company, you need to take more serious. Understand the governance and the risk and your profile there. People just don't.
Absolutely.
It's part of leadership. It has to be part of the conversation.
It has to be part of the conversation, and they have to be at the leadership table also, because
Yeah.
that has to be treated as the number one priority of every organization.
And they always look at it as a cost center, and it's very unfortunate. We can't have that old reactive mentality. Yes, it costs something, but it costs, so that's when the risk comes in. It costs more to not do something and take no action than it does to take action.
I totally agree. And I often tell people, look, if the exposure happens, you end up on the front page. If you resolve the exposure and there was no damage done, they bury that on page 29. And all people remember is what was on the front page. And on the front page was so and so disclosed today that they may have exposed X amount of data to, of people's data, PHI data. And then after the investigation, if it turns out there wasn't an exposure, you're not reading that on the you're not
Right? And it always baffles my mind too when these exposures come out and they're like, oh, I'm putting all of my faith in this company to protect my information. Then they get exposed. But you should, in retrospect, be protecting yourself. So if something does happen to a company, you're not exposed. So at the same time, it's not just the company responsibility, it's us as leaders and people, our responsibility too. Because we can do it, we can protect our own stuff if we have the right tools and understand and have these conversations.
absolutely, because you know what? It's not just these IT people. It's the
Mm-mm.
employees because they're getting emails that have dangerous links in them and, "Hey, click here and, update your password," when they're not really looking at what the URL is that they're being asked to click to. And
No.
so as an organization, our IT department puts us through testing where they send out fake phishing emails to people, and if you
What? You guys actually do that?
yes, and if they click on it and they, by mistake, they gotta retake the training courses. And, so you get into this habit of, you know, getting and it's hard because people are trying to work so fast.
But that's the point of it, though. The hackers take advantage of that. They know you're going fast and you're not paying attention. And like you
Correct.
said earlier, to slow down and take a day or two. Well, maybe not with all your work, but just to pay more attention. Because that slowing down will help tremendously.
Yeah, and I mean, I'll admit, over the years, I've missed a test or two, and and I've gone back through training, but and our IT department has gotten very sophisticated with their fake emails and different things. But you really have to be careful, and you really, it doesn't take long to hover over a link to see where it's really taking you. But it's
Right.
amazing how many people don't take the time to do that.
Yeah, and also with that, like you said, your company's doing it well. They have things in place to help mitigate that. A lot of companies don't bring that to the table and understand that they need these things. And it's not just one thing like phishing, it's a bunch of things combined. You have to have the IT, the cybersecurity, the phishing, compliance, risk assessments, all these little things you have to have in the combination to understand to help protect your company.
Totally agree. Totally
Yeah.
agree.
It's a lot. It can be overwhelming, but it shouldn't have to because as a leader of your company, as that CEO, you should be understanding that, hey, I don't know how to do this. I don't have this skill, but I need to bring this person to the table, bring this partner over here so that we can figure this out together. Those are the conversations that are just not really there. They're like, oh, we have IT, doesn't really matter, whatever. But you're protecting your company, but you're not protecting it.
Security has to be the number one priority of every organization. There's no doubt about that. No doubt about
I believe it starts with leadership because that's your company. What are you doing? Maybe I need to make like the 6 pillars of effective cybersecurity leadership.
Hmm.
I won't take that one from you.
Okay. Fair enough. Fair enough, Justin.
Yes, we got off track there in the security portion, but I do enjoy those conversations as well. But they do definitely go together with leadership.
They absolutely do, and I think it resonates with your audience as well, and how we
Yeah.
can tie those together, because we're all in it together.
Yes, 100%. Like we said, it's not just one person, it's everyone's responsibility from the janitor to the receptionist to the CEO. We all work for this company. So we need to change that narrative and reframe that we all have a role in this to play together and can't take that self leadership charge of ourselves and our
Very
role. These are things that we don't really talk about in companies. That people just do their jobs or they just go about their day. They just don't really understand that they're working for a company that they should take more of a role. But like you said earlier, that people just aren't taking that responsibility in themselves and they work here. They're just going about the day too fast and everything. It's interesting to kind of think about sometimes. Like where are we going to be? Like example, AI coming into play now, and a lot of our jobs, a lot of leadership don't understand how to implement that into their company correctly, and people are just like the wild west. Here's my data. Here's my data. Here you have some data, and I've seen that, especially in healthcare. What's your thoughts on that?
So I don't have an issue with AI, but I also know that AI is not going to replace as many jobs as people may think, because the computer or AI cannot think like a human and can't detect the human emotion that a manager and an employee have in interaction. So there may be tasks that AI can perform for us, like finding fraudulent claims in healthcare, but it's
Yes.
not going to replace the interaction of the person that takes those results and has to communicate them to a team or to constituents within the healthcare domain. So I don't think the impact on lives is going to be as great as people think. We'll always need people to participate in that. The tools may just get automated and may get more sophisticated.
Some AI may be smarter than some of these humans out there, but that's not for me to say.
Correct. Nor me. Nor me.
No, yeah, we don't have those conversations. Oh wait, this is being recorded. What has your career been like in healthcare as well? I'd like to kind of know more about that. That whole
So
healthcare sector. Yeah.
yeah, it's been very, very rewarding. I have worked both at the insurance company side.
Ooh.
I've worked on the provider side. I've helped start health plans. I've been on the technology side of healthcare. So I'm one of those rare people that have spent
Yes.
time on the payer and the provider side. And so I understand both sides of the transaction, and how it's funny when you go back to the 90s, the big thing was for insurance companies was grouping diagnosis codes or procedure codes together to reduce reimbursement. And the company that made that grouping software also made software to degroup those items for the providers. So they were selling one version to the insurance
Wait a
companies
second.
to combine procedure codes, and they were selling similar technology to separate procedure codes. Like take, for example, an adenoidectomy and a tonsillectomy. They're often performed together. So an insurance company would pay less because it's the same surgical instance that it's being performed. Well, the provider software, before they submit the claim, will separate that into two separate procedures as if they were done separately, but they weren't. The data service was still the same. And then it hits the insurance company, and they would combine it back together and lower the reimbursement rate.
Okay, I'm confused here. I feel like that's still going in so many different directions, and there's something needs to be cut out there.
I don't think that exists any longer.
Okay.
But if you go back to the mid to early 90 or mid 90s, that software was pretty much marketable everywhere. And yes, and you don't see it as much today because of the contracts that insurance companies use today are a little bit different, and they outline how they're gonna treat procedures when more than one procedure is performed. So the contracting has gotten more sophisticated, the systems have gotten more sophisticated.
That's why it's gotten more expensive. That makes sense now.
Well, that's not the only reason. I mean, there's a lot of reasons why healthcare is expensive in the United States, but, you know,
Blows my mind.
it
Yeah.
is it is different than other places around the globe, and let's face it, if something's wrong with us, we wanna know now how to fix it, and we're more of a "we wanna know now" society than what
Right.
some.
Yeah.
Correct. "I need to be seen today. I only have an earache, but I want an appointment in an hour."
Right. And it's interesting because that kind of reactive mindset is kind of like what we were talking about to be proactive. That wouldn't really be the place. So if you're real proactive on your health, for example, eating right, doing the right exercises, is being more proactive, like you would in your life, your business, etc. You wouldn't be so reactive to like, oh, I need this now, because that would probably wouldn't be an issue for you, you
True.
know. But we
Yeah,
don't teach that here. It's weird how the healthcare works here. React, not proact. Like, what? I don't.
It's a little bit different than, for example, in Canada. I mean, emergency surgeries in Canada, they happen. But if you need, let's say you want your knee replaced, that's not an emergency situation. And so you probably
Yeah.
are going to wait a period of time. Now, it is painful to endure, a damaged knee, but it's not life threatening. And so, in the Canadian system, you have to wait for an opening, and that may be a month or two down the road, or even more potentially, depending on how many people need that particular procedure. But again, I if it was that bad in Canada, we would have a lot more people running across the border for care. And I don't think we see a lot of that. I think we see a little bit, but I don't think we see a flooding
I've
of.
heard that joke a while ago. It's like, well, I'm just gonna move to Canada, then they have better healthcare.
Yeah, but
I hear that.
you're gonna pay for it through your taxes. So, and I don't think people really understand how healthcare is financed in other countries.
I don't think I understand that quite well either. No.
So, for example, now I don't have current stats. Back in the late 90s, I worked with a company that was based in Canada, and I learned a little bit about, in the US, the average worker who's making, let's say, 50 or 60,000 is probably only paying 18% in taxes or less. In Canada, they would be paying 40 or 50% in taxes. But that's how they fund healthcare. So, when we talk about having
Wow.
a single payer system, you still have to fund healthcare. And so if your employer's not contributing to fund it, then it's going to come back to us as individuals.
That actually makes sense, but wow, that is phenomenal.
And that the thing is, people in Washington don't educate Americans about what it's like in other places. They just say, well, we should have the same system as they have in England or in Canada,
But
not
how's it working?
not explaining to the American public that it still has to be funded some way. And I think if more people understood the way it really works in other countries, they'd see that the employer sponsored system that we have here and the government sponsored business we have here, like Medicare and Medicaid, is really not that bad. And it satisfies that I want it now type scenario where everybody wants to try to get into the doctor as quickly as they can.
That actually doesn't make sense. Don't really tell us or show us a lot of things because it's like, if they don't know, it's not gonna hurt them. They're not gonna research it anyway. But some of us do research it. Some of us do find out things. Some of us get on podcasts and we talk about it, and now it's out there. So I mean,
And I'm often, at work, I'll find articles of things that related to healthcare that most people aren't aware of, and I'll share it with people. And I
ooh,
often send it out, and I always get responses from people of thank you for sharing because they just don't know. They're not exposed to that. It's like the average person probably doesn't understand how much fraud, waste, and abuse there is in healthcare here in the United States. I mean, but if I read an article just last week. It talked about the number of cases that went to court in the first quarter of this calendar year that had to do with medical fraud, waste, and abuse. It was over $230 million.
Now, these are like clinics and doctors' offices abusing insurance kind of thing?
Well, yes,
Or
or
both?
insurance companies as well doing not good things. Just in Q1, over $230 million. Now factor in how much
What?
it's gonna cost to litigate those cases, right? And who's gonna pay for that? We're paying that. We're paying that cost.
We're not just going to print it, you mean? The
We pay
reserve
for
not going to print it for us to pay?
well,
No?
we pay for the judges and the court system and all of that, and that comes out of our tax dollars.
True.
But there is a fair amount of fraud, waste, and abuse, and that impacts the price of healthcare.
I can see that 230, but my goodness, of course that would impact healthcare prices. My gosh.
Yeah, I forget what the number was, but on a yearly basis, it was in the billion range and multiple billions in terms of the estimated amount of fraud, waste, and abuse that exists. And if you think about it, I don't want to give any of your IT people any ideas, but if you've been to a doctor and have gotten a detailed bill from that doctor, all of the information that's on that claim is the information you need if you were going to try to set up a fraudulent operation and try to bill insurance companies or the government. It may be complicated from a systems perspective to produce a claim. However, the information is easily acceptable to everybody. And so the bad people figured that out.
That makes sense because if they get hold of that, that's why I always tell people you should shred stuff. Get a shredder. But that's why we have HIPAA and compliance that comes in. That's these regulations, how we should handle information, what we should do with it. But I feel like there's just not enough teaching out there for it. It's more like you do this, or you're supposed to do this or don't, but they don't really give you practical things that actually you can do yourself.
And the other thing that we need to do is get rid of paper, make everything electronic. And we have struggled in healthcare to make everything electronic.
I've struggled with clients and companies I've worked with to get them away from printers and paper myself and get on iPads. It's hard. They're like, well, what's the cost of it? It's going to cost less in the long run if we do this and maybe a little bit up front, but it's going to save your company and actually protect patients more. But they're like, oh, well, hogwash.
I mean, there's no reason for the doctor to mail in a chart that's this thick to review for a medical review. Why can't that be? And it should be able to be transmitted electronically. And one of the things that we do is transmit things like that electronically. And then the other thing is, if it's submitted electronically, it doesn't need to be printed out at a printer and then scanned into a system or handed
Oh
to
my
somebody to
God.
review.
I see that all the time.
Correct.
It's mind blowing because like these they're like patient care coordinators that sit in these clinics and they have to go through all this paperwork. They print it, they scan it, then they file it over here. I'm like, that's so redundant.
Correct.
And it's
So,
just,
so redundant.
but like to change that behavior, it almost have to take like an act of God or a fire or a regulation, something, and
Well,
still expect somebody like, nah, we don't do it. We don't care.
I think CMS is starting to look at those things when they came out with these required FHIR transactions. What they're really trying to do is force automation in healthcare. I mean, government tried that in 1994 with the first HIPAA transactions. But the reality is, not everybody adopted a standardization. Everybody added extra data to it. And so now every individual's 834 transaction contains different information and additional fields that payers and other people have to deal with. But the FHIR capabilities, I think, is hope for us that will create some standardizations and force
Yes.
the system to be more efficient.
We have to force. I know the HHS is coming down on managed service providers such as myself. for us to be more diligent in our security and what we actually provide to these clinics and doctors, and how we do our job to be more secure. It's kind of forcing our hand, but it should have been there all along, really.
Absolutely correct.
Then again, it's a leadership problem. It seems like it always comes from a human being and a leader that these issues arise. It's quite interesting, a human condition. I want to thank you, Jim, for coming on here and talking with us today. I really enjoyed the healthcare stuff as well. I could go down this rabbit hole for hours. I'm just like, ooh, tell me more.
Just have to come back another time and we'll have another chat.
Yes, I love healthcare because it's a big thing. I'm in that field, and it's just having these conversations, and hopefully the right people see them and they kind of start getting this in their mind that they need to do better, be better, and just become better for themselves, their companies, the people that they're supporting in these healthcare organizations. I always say this, there are CEOs and there's leaders. Not all CEOs are leaders, but not all leaders are meant to be CEOs.
That is
And
correct.
I'm learning that truth so much more as I have these conversations, as I interact with people in the real world. And it's a scary place out there, let me tell you. Sometimes you want to crawl into your couch and cry, but that's for another conversation.
That's a deeper conversation.
Yes, a real deep one. We'll have a therapy session later. Before we go today, is there anything that you would love to leave our audience with?
I think one thing, and I told myself this many years ago, it's all going to be okay. Yeah, we have to deal with a lot of minutia and a lot of things, but I think we're going to be okay. I think, as a country, we'll survive. I think, our systems and things like that will come along. We'll always hit a bump in the road, but it'll be okay. We'll survive. And I think I would like to leave that with your audience. And the other thing is too, if they want to, certainly learn more about leadership, they can certainly look me up on my website at jimcarlough.com or check out my book if they're looking to improve their own leadership styles and capabilities. But the other thing I'd leave with them is, especially for young managers that are probably in your demographic ranges, don't be afraid to find a mentor to help you. I very
Yeah.
much believe in the mentoring program. And that's how I got started in this leadership stuff and helping people be a better leader, because I mentored so many for 25 years. And I can tell you the benefits of that. I even have a mentor. In fact, I have more than one. And I enjoy talking to them, just like this conversation. And
Yes.
learnings come from that. So if you're a young manager or even an established manager, find a mentor, someone other than your manager, that can help you talk about situations like that. And if you don't know how to find a mentor, reach out to me and I'll help you. I can give you some direction on that.
Love that. Very valuable information. Now, also, not all managers you can reach out to. Some of them may not have what it takes to help you get to where you need to go.
Correct.
And
Correct.
that's okay. Make sure you're learning from the right people and taking the right advice. If
That
it
is
feels weird, it doesn't feel like you, take a step back and kind of reanalyze it. What do you think? Is this the person I want to be leading and teaching me? Can I learn from this? I always say to people, you always want to learn from someone who's already been where you are or is on that path, not someone who's never done that work, has never been there.
that is true. That's very true.
And that makes more and more sense to me each day, especially I come across a lot of different leaders and people. I'm like, what are you doing? Like, what? It blows my mind. They'll charge you thousands of dollars, or they just do all kinds of just things. They're just not, I guess, leadership material. Like, they have more of an inner thing that they need to do first before they
Mm.
can lead people. Yeah. But some of us do the work, some of us don't. Thank you, Jim, for coming over here and spending your Saturday on here with us this morning. I really appreciate that. We'll definitely have to have you on here again.
Well, thank you for having me. I've enjoyed being here, and let's keep in touch.